CIMMYT scientists have been breeding improved maize varieties adapted to sub-Saharan Africa with high yield potential and stress tolerance. Breeding for resistance to maize lethal necrosis (MLN) is a new challenge. MLN has emerged as a major threat to maize farmers in Kenya since September 2011. A scientific team from the Kenya Agricultural Research Institute, CARI, and the CIMMYT Global Maize Program joined hands to identify the disease. They identified the infection of maize plants with two viruses, maize chlorotic mottle virus and the sugarcane mosaic virus, transmitted by insect vectors. Efforts to identify maize varieties that are resistant to MLN began with close cooperation between CIMMYT, CARI, and the seed sector under the Seed Trade Association of Kenya, STARK. A wide array of inbred and pre-commercial hybrids is being evaluated under natural disease pressure and artificial inoculation at two field sites in Naivasha and Narok in the Rift Valley of Kenya. To conduct artificial inoculation, inoculum of both viruses that cause MLN is generated in greenhouses and then applied to trials using motorized backpack sprayers to facilitate infection. The emergence of MLN in Kenya is of serious concern in the East African region, where maize is the staple food and source of subsistence and livelihood for millions. In February 2013, scientists and key stakeholders from Kenya, Uganda, and Tanzania met in Nairobi, Kenya, to develop strategies for MLN management.
What this meeting plans to achieve, therefore, are diverse objectives. The first one is, of course, to bring together these very, very important stakeholders from different institutions in Kenya, Tanzania, Uganda, understand, first of all, the extent of the disease from those country representatives, and then plan cohesively for the next steps to tackle this challenge. So this provides us, first of all, an opportunity to assess the severity and the extent at which this disease is occurring in these three countries. That's the number one objective. The second objective is, at the scientific level, more to do with the understanding of the epidemiology of this disease, how this disease actually happens, what exactly is the biological nature behind this disease. It's a new disease in Africa, but it is certainly not a new disease for the maize scientists. So we need to understand what are those lessons that elsewhere in the world people have learned about this disease and how to adopt this understanding in Africa.
Seed company representatives, officials from the Ministries of Agriculture and regulatory authorities in Kenya, Uganda and Tanzania, as well as experts from the US participated in the meeting.
The partnership between CIMMYT and CARI in this initiative is crucial, because it is the only way we can be able to address the problem, because partners can mean a lot. CARI has some capabilities. It has facilities that can be used. It has land that can be used in launching the trials. In fact, maybe 2 of our trials this season will definitely be on CARI land, mainly in Naivasha and in another center. And CIMMYT will definitely come in with the support that we need to intervene and to conduct these trials. The funding, the support in funds, and also expertise. And they have also lines which they have donated for us to test in the areas that are affected.
MLN was a disease actually that caught the government and also KEFIS as a regulatory agency by surprise. This is because it's a disease that had not been noticed in the risk assessments. And as we came to discover later, it's also a disease that is not well known all over the world. So when it came at first, it was very difficult even to tell what it was. But KEFI stepped in and we took several precautionary actions as is allowed by the International Plant Protection Convention. However, the disease causes a lot of challenges because there's very little scientific information, and most of the decisions in regulations are supposed to be science-based. And so most of the precautions we are taking them as we wait for more scientific information, especially on the organisms that are causing the disease, how they are spread, and how they can be managed. And from there now we can be able to sit together maybe as stakeholders and make regulations that are science-based.
All partners are committed to ensuring that a lasting solution to MLN is found. The good news is that scientists are making significant progress in tackling MLN.
We are seeing a range of responses under natural MLN pressure. We have tolerant material, moderate or tolerant, and then completely susceptible. We will use the moderate tolerant and the tolerant material for further breeding work to derive resistant hybrids to MLN in the region.
At this stage, as you've seen, identifying those hybrids which are tolerant. We know the inbred parents, we're scaling up the seed of those inbred parents. And I should think that if we can work as a team amongst all the players in this country, we can get this seed into the market within 2 to 3 seasons. And by 3 or 4 seasons' time, I think we'll see a rapid change in the kinds of varieties that farmers are growing in this country, from replacing those susceptible varieties and bringing into place the new tolerant and resistant varieties. So within 2 or 3 years, we should be able to get on top of this disease in a very good way.
Researchers are optimistic as several elite inbred lines and pre-commercial hybrids developed under the CIMMYT projects such as Drought-Tolerant Maize for Africa, DTMA, Water-Efficient Maize for Africa, WEMA, and Improved Maize for African Soils, IMAS, are showing resistance to MLN. This was evident when participants visited one of the screening sites in Naivasha. Plans are underway to establish a centralized MLN screening facility in Kenya that will be accessible to seed companies and national agriculture research programs in the region. This will aid and accelerate the development and release of MLN-resistant varieties to enable farmers continue maize cultivation and ensure food security without worrying about crop losses due to MLN.